Good morning, everyone. So, we are starting with chapter number 23, and the name of the chapter is Role of the State Government in Distribution of Resources. First of all, understand that what is the meaning of this chapter. That resources are very important for any country because resources are scarce, they are very less. So, its distribution and allocation, a proper allocation is very important. And because the state is actually managing the whole affairs of the state, so it is also very important that how these resources should be utilized in order to provide balanced kind of approach, balanced growth and welfare of the society. So in this chapter we are going to concentrate on about how the resources are allocated. So first of all, what is the resource? Resource is something which is the wealth of a country. Means whatever the country has, which has some value, that is the wealth. Okay, so that is the meaning of the word resources. Now resources can be natural, material, and human. Okay, natural resources like forest, mines, all are natural resources. Materials are there. Okay, and a human being. That is the resource of the country. So the most important objective of any government is that to provide proper allocation, that how these resources should be used in a manner that every person gets its benefit, can reap its benefit, especially those people who are poor and does not have money to get services from the society. Okay, another thing is factors involved in distribution of resources and services. First of all, that how this resource allocation is done. So before 2015, there was one government organization, that is Planning Commission, and the Planning Commission used to undertake the whole process of resource analysis and allocation, that how many resources are there and how they should be allocated. That was done by Planning Commission. But after 2015, Niti Aayog was formed. The full form of Niti Aayog is National Institute for Transforming India. That how the India should be transformed from a developing country to developed country. Okay, that is the main objective of Niti Aayog in order to provide the better services. Okay. So first of all, what is the process of resource allocation? The process starts from the assembly, when all the cabinet ministers are there, and cabinet minister they present a bill regarding what they require. Okay, how the resources should be given to them in order to provide services. Now that bill is actually present in the form of proposal in the assembly. It is discussed and debated, and then it is decided that whether that bill should be passed or not, that whether the resources should be allocated to that bill or not. So this is the process of resource allocation. Okay, so passing of a bill depends upon a balanced plan. Okay, the passing of the bill depends upon that how effective is the plan, how effective is the draft or a proposal. Okay, because India is a kind of a country in which there are certain areas which are very rich, but there are certain areas which are very poor also. Okay, there are still so many states and villages and town which does not even have the basic facilities are there. There are so many backward regions are there. So how a balanced growth should be there, so that is the main motive of the government, and before looking at that, then only the resources are located. Fine. Now the most important the role of the government in resource allocation is to provide health. The health is very important because the human being is the most important resource for any country, because human being is the person who takes ahead a country from a poor country to a rich country. So that is very important for a government to invest money into health, so that they do not have to invest money into the future, because if this generation is going to have a bad health, then they have to be invested, then we have to give medical health and help to them in the future also. So it is better that we take precautions now, today. Okay, so that we do not have to pay for it in the future. Now, according to WHO, what is the meaning of health? The meaning of health is that health has three important dimensions. Health does not constitute physical health only, but it also constitutes social health and mental health. Physical health means that our organs, our body should be working perfectly. Social health means that a person should have a good job, house, basic necessities, okay, a good surrounding and family. And mental health is that a person and his surrounding should be in harmony and balance. Okay, so these are the three important dimensions of health. Now regarding the healthcare facilities in India, in every country there are two kind of healthcare facilities. The first is public, second is private. Obviously the public healthcare facilities are owned by Government of India and they are run by the Government of India, and the services are actually available to the poor people at a very low cost, or even they're free. Okay, and the healthcare facilities, public healthcare facilities, are available both in urban and the rural areas, so that each and every section, every part of India gets services from the public healthcare. Okay, private healthcare, on the other hand, is owned by the private people, privately owned people and organizations, and obviously they are not cheap, they're expensive, as big as the hospital is, they will charge the higher fees only. Okay, so private healthcare facilities is actually not easily affordable by the common people, and that is why it is very important for the government to spend money in public healthcare services so that even the poor people can easily afford it. Then the government has started National Health Mission in the year 2013. Before that, there were two programs already running. The first is NRHM, that is the National Rural Health Mission, means in rural India. That was started in 2005. Then in 2013, NUHM was started. NUHM was also started, that is National Urban Health Mission, to provide services into the urban area. They both come under the category of National Health Mission. Okay. National Health Mission also provide facilities, infrastructure and money to all these programs. The first is National Rural Health Mission, National Urban Health Mission. Communicable diseases mean those diseases which spread easily. Okay. Non-communicable diseases including injury and trauma. Maintenance of infrastructure. By the word infrastructure we means maintenance of buildings, hospital buildings and clinics. That is the infrastructure. Family welfare sector also. So this is about National Health Mission. National Health Mission in together with the Niti Aayog is also actually making health index. Now what is a health index? Health index is actually an index in which the health of the people are ascertained, that how the health of the people are different from the previous year. It is a data of every year in which the health is measured. Okay, in which they decide about what is the death index, what is the birth index, everything is taken in account and then a health index is made. Okay, in India, Kerala is doing the best work in providing free healthcare services to the people. The government has done a lot of initiative, and in this chapter also you have been given a case study regarding the healthcare services in Kerala. Okay, so this is about your whole chapter. Thank you so much.